Okay, so today we are looking at the Partograph. When it comes to the Partograph, you'll find that during OSC, probably they'll give you a dummy with certain parameters. So now, apart from that, in the actual sense, or why we use the where we use the Partograph is that we use it in labor, and we use it to monitor the progress of labor. You'll find that most you will check the Partograph in an interval of 4 hourly, and then you monitor how the labor is progressing. Apart from that, when it comes to the Partograph, mainly you just need to understand how to plot it and how to interpret the findings. So as usual, when a client comes, you need to fill in the client's name. Apart from that, fill in the gravida, meaning how many pregnancies have they had, and you need to count the one that they have come with. So if the client has had 3 pregnancies before, and this is the 4th one, you're going to record D4. And para is the number of live births or number of children that live birth that they have had before. So in this case, you say 3, and probably +1 because they have come with the 4th one. Then you need to fill in the hospital number, date of admission, time of admission as well, and you need to indicate whether the membranes are still intact or they have ruptured. Then also fill in the hours, the time at which the membranes had ruptured. So after you fill in that demographic information for the client, you will now start with the section, this particular middle section, talking about the descent as well as the dilatations. So we'll move on to this particular section. Okay, so we need to start with the middle section, and this section, this one, which is talking about, because that is where you start from. You talk about the dilatations, the descent, and the ends. Okay, so where is the eraser? I just remove these numbers. Okay, so that is where we are going to start from before we move on anywhere else. The reason we start from this particular section, it's because you only open up the Partograph if the cervix is 4 centimeters widely open. That is when you open the Partograph. So in this particular case, we'll start first of all by checking the descent so that we take note of, the cervix dilatation, so that we take note of how wide the cervix is dilated. So you need to have the knowledge of vaginal examination when you're plotting the Partograph, because VE will be mainly done 4 hourly when the woman is in labor. So let's take the woman has just been brought, and at that particular moment when the woman has been brought, the cervix is 6 centimeters wide dilated. You go in with the 2 fingers and you measure the dilatation. You find that it is 6 centimeters widely dilated. You will find that you are going to go where there is 6 here and follow this particular line, and where it intersects with the alert line, you are going to put an X like that. So the normal figures when you're plotting on the Partograph should lie on the alert line and not on the action line. So we'll talk about the action line later on. But then you find that if the woman comes at 6 centimeters wide dilated, you follow the line and you put an X where the line intersects from on the alert line. Then from there, the other thing that you need to do is that you need brought in. Okay, so you need to fill in at what time has this client of yours be, or also follow it up nicely, how the graph is subsequent observations. So in this particular case, let me just remove these lines. Okay, so in this particular case, what we said was the woman comes in and the cervix is 6 centimeters wide dilated, meaning you plot there, and then you need to follow this line here. So if the client was brought in at 13 hours, you're going to put here as 13 hours, and this becomes your hour 1 since the client was brought in. But if the client was brought in with a cervix dilated at 4 centimeters, meaning your X is literally here, and your hour 1 is this one. And if this was 11 hours, you put as 11 hours. So this indicates a full hour, and this will be our hour 2. So if the patient reaches for 14 hours, it will be hour 2. And this will continue. You keep on plotting like that, 16, 17 hours, and this will continue changing to our 3, and this will be our 4, and this will be our 5. So this will continue like that. But remember, mainly we will check the cervical dilatation at least 4 hourly. But mainly in normal circumstances, the cervix should just dilate about 1 centimeter in 1 hour. So if you're doing it 2 hourly, you need to know that at least the cervix should only dilate about 2 centimeters in 2 hours, or 4 centimeters in 4 hours. So we expect a client who has been brought in with a cervical dilatation of around 6 centimeters to reach around full dilatations, which is 10 centimeters after 4 hours. Nevertheless, sometimes you'll find that a woman comes in at 6 centimeters, then after 4 hours, the cervix is still at, after 4 hours, the cervix is still at 7 centimeters. It means that you are going to plot, let's say you go after 7 hours, meaning you are going to follow this line and where 4 hours is. After 4 hours, you find that this particular woman still has the dilatations of around 7 centimeters, meaning you may plot somewhere there. And you find that this particular graph has started shifting from the alert line. It is heading towards the action line. So in this particular case, you need to determine what is causing this graph to deviate immediately, because it could be maybe pelvic disproportion. It means that this baby won't come out. Probably you need to take this woman from an emergency section, or other causes like a weak uterine wall or other things. So immediately the graph starts heading towards the action line. It means that there's some action that you need to do to make this woman deliver. But in normal circumstances, you'll find that maybe after 4 hours, the same 4 hours that we are talking about, at hour 4, when you check the cervical dilatation, probably you'll find that they are at 10 centimeters widely dilated. It means that this particular woman is now ready to start pushing to deliver. So those are circumstances through which you may see the graph shifting to action. It means it is prompting you to do something because this labor is not progressing normally. Okay. So that is about the plotting. So after you plot those figures, the next thing that you need to do as well is the descent. You need to check the descent. So when it comes to the descent is either 0 over 5. At this particular point, it means that the fetal head is completely in the pelvic brim, and this baby literally is ready to come out. But a descent of 5 over 5, it means that this baby is still very far from coming out. And the reason we use the descent by using 5 and number 5 figure is because we are using our 5 hand to measure descent. So you put the 5 fingers from where the symphysis pubic bone is and where the bulging or growth of the pregnancy is starting from, and then feel how many fingers are able to feel the fetal head. So if about when the woman is brought in at 6 centimeters, you find that about 4 fingers are able to feel the fetal head. It means that you put a 0. You need to indicate with a 0 like that, where 4 is and where it is intersecting with the 6, because this is the time we had opened this particular partograph. If we opened it at 4, you put an intersection 0 on this particular line, because we have opened it at 4 centimeters. But in this particular case, because our partograph is opened at 6 centimeters, so our 0 will be here, indicating that the descent at 6 centimeters were at 4 over 5. Then as you continue checking, you'll find that when it comes to descent, you need to do it after each vaginal examination, which you can do it at 4 hourly or at 2 hourly. Then apart from that, you need to also document the time, that is how the descent is taking place. Maybe let's say after 4 hours, you do vaginal examination, you find that the descent is now at 2 centimeters. It means that roughly after 2 hours, the descent may come and be at 1 centimeter, or literally at 0 centimeters, meaning 0/5. So when the graph is moving in this particular manner for descent, this is normal, because it needs to move all the way from 5 going down to 0, because at 0 it means that you're now ready to deliver this particular woman. So that is how we plot descent, and we use our 5 fingers to assess how the baby is descending, entering or passing or negotiating through the pelvic brim. So after checking the descent, you now come to this particular portion, which is labeled amniotic fluid. This particular portion labeled amniotic fluid, and also check for moulding. So amniotic fluid, let's say we are following still this particular line. So at 6 centimeters, rather we had plotted this line. So all the way up, we'll still record our information the time we had opened this partograph in. So our recording should be in these boxes like that. Okay. So apart from that, when it comes to the amniotic fluid, so when it comes to amniotic fluid, you check whether the amniotic fluid, which is basically the liquor, which we call liquor, whether the membranes, the first thing, whether the membranes are still intact or if the membranes have ruptured. So if the membranes have ruptured, on top there, you record with a C. And this showed that membranes ruptured with a clear amniotic fluid. Then apart from that, if the amniotic fluid have just ruptured on your face, you need to observe or check what color it is. If the membranes are still intact, you indicate with an eye on top there where it says membrane, it means that the membranes are still intact. However, when you go in with 2 fingers, you find that the membranes are meconium stained, meaning the membranes, the amniotic fluid rather, they are meconium stained, meaning they are mixed with the feces of the baby. You are going to indicate with an M here. It shows that the amniotic fluid is meconium stained. If it is odd meconium, if it is odd meconium as well, if it is odd meconium, you indicate with the OM. You indicate with OM like this. And this showed that it is odd meconium. Then apart from that, if it is blood stained, you are going to put a B, showing that the amniotic fluid is blood stained. So this would determine what you find at that particular point, whether the amniotic fluid is clear. If it's clear, I've said you indicate with a C, which is normal. But if it is meconium stained, you indicate with an M. If it is odd meconium stained, you indicate with OM. Then if it is blood stained, you indicate with a B. Then from there, the next thing that you need to do is check for moulding. So remember moulding, this you observe how the fetal skull, the bones of the fetal skull are overlapping each other, or whether they are opposing each other. And if they are overlapping each other, meaning one bone is resting on the other, one fetal skull bone is resting on the other, and you determine whether they are reducible or not reducible. So in this particular case, when you check for moulding, you find that the sutures are meeting but not overlapping each other, meaning the bones are just like that, but they are not resting on each other. You are going to indicate with a single plus like that. So 1 plus shows that the sutures are opposing each other, but they are not overlapping each other. But if the sutures are overlapping each other and they are reducible, so if the sutures are overlapping each other and they are reducible, meaning one bone is resting on the other, and when you use the pressure of your hand, they are able to be reduced back to normal like that, it means that you indicate with the 2 plus like that. So in the box of moulding, you are going to indicate with the 2 plus, because as you are doing VE, you go in, you feel that the bones are overlapping each other, and when you reduce them with your 2 fingers, they are reducible. That is what the 2 plus means. Then if you find that the sutures are overlapping, the bones, the fetal skull bone are overlapping each other, but they are not reducible, you try to reduce them with your fingers, they can't be reduced to opposing each other, it means that you're going to indicate with the 3 pluses like this. So you put 3 plus, it means that the bonds are overlapping each other and they are not reducible. So on moulding, that is what you indicate based on what you find. If the sutures are overlapping each other, if the sutures are opposing each other, you indicate with a single plus. If the sutures are overlapping each other and reducible, you indicate with a 2 plus. If the fetal skull bone are overlapping each other and they can't be reduced, you indicate with a 3 plus. So that is about the moulding. Then we can move on to the next parameter. Okay, so let me just wrap this so that we have a clean working area. Okay, so we can move on to the next parameter. So when it comes to the partograph as well, it has an area where you need to plot the fetal skull as well as the contraction. So we'll come to the contractions later. When it comes to the partograph, you also need to observe the fetal heart rate. So when it comes to the fetal heart rate as well, you need to have a fetal scope and you check the fetal heart rate frequently. So if you find, as you check for the fetal heart rate, if you record, you find to say, oh, the fetal heart rate is 120 over, 150 over or 130 over 120, then you record it as such. So since we are following this line at 6 centimeters, you follow it all the way up. So let's say the fetal heart rate is at 120, then you are going to plot in that particular manner. Then you move, if it's going at 140, then you're going to put an arrow like that to show that the fetal heart rate, when you checked at 6 centimeters, it was around 140 over 120. Or if you check the heart rate rather, which is just basically the pulse for the baby, it means that you're just going to put a dot at where the fetal heart rate is. So if the fetal heart rate is 130, you follow as usual this line or at 6 centimeters and just put a dot to show that the fetal heart rate it is at 130 beats per minute. Then if you check again after 2 hours, you find that the fetal heart rate probably is at 120. You record it like that until you continue recording until the baby is born, and you then be joining these lines like that to see how the fetal heart rate has been moving from the time of admission until when labor is ready to be completed. So in terms of the fetal heart rate, you need to plot it in that particular manner as well. So you need to listen for the fetal heart rate and then plot it on the partograph. Okay, so apart from the fetal heart rate, then we can move on down and talk about the next parameter. So then the cervix dilatation as well as the descent, you fill in the hours there. The next parameter that you need to look at are the you need to observe them every 30 minutes, and you need to feel for how many contractions are you able to get in 30 minutes. In 10 minutes. Every 30 minutes, you just take a 10-minute period to observe or feel for the contractions, and you count how many you're able to feel in that particular space of time. Okay, so now let's take, for example, okay, now, so let's take, for example, you check the contractions in the first 30 minutes while the woman minutes. So in the first 30 minutes period for contractions, about 4 contractions, and these are not lasting more than 20 seconds. You are going to plot by using dots like that. So you plot all the way by using dots if you're able to feel. So in this particular case, you plot to say you felt 4 contractions in 10 minutes in the first 30 minutes of admission. And then those contractions, each one was not lasting more than 20 seconds. You use those. But then if you feel for the contraction and you find that each contraction or contractions are lasting between 20 seconds to 40 seconds, you are going to use basically lines. So you are going to feel if you're able to feel 4 contractions in a space of 10 minutes, you're going to fill these boxes with lines to show that this woman has moderate contractions. So you fill them with lines. Then apart from that, if at all the woman is able to feel contractions which are lasting more than 40 seconds, in this particular case, you are going to shade these boxes in that particular manner. So you fill the boxes. So if the contractions were 4, you fill the boxes by shading them. And when you shade, it means that the contractions, the 4 contractions that you had felt, this woman was able to experience each contraction lasting more than 40 seconds. If you use line, it means that the contractions were between 20 to 40 seconds. If you use dots, it means that the contractions were between 0 to at least less than 20 seconds per each contraction. So that is how you shade the contractions, and you place the hand on the abdomen, and you can literally feel and count how many contractions you're able to count in a space of 10 minutes when the contractions start. So once you fill in this particular portion based on what you're able to get, you now move on to oxytocin. So remember, oxytocin promotes contractions, and you mainly give it in IV fluids while in labor. So if at all in labor you have given the oxytocin here, you need to record the oxytocin as well as the drops in 1 minute. So if your oxytocin given is 10 international units, you write 10 here and you put a stroke per liter. So it means that you have pushed in 10 international units of oxytocin per liter in 1 liter of fluids. Then apart from that, the drops per minute, of course, you would have calculated the drops in a minute, whether it is 23 drops in a minute, 38 drops in a minute, or 42 drops in a minute. So if it's 42 drops in a minute, you put here 42 to show that the drops in a minute that are going through the giving set, they're about 42 in 1 minute. So this, you record it if at all you have given oxytocin. If you have not given oxytocin, meaning you leave it blank, unless if you give oxytocin so that you augment labor or you quicken labor. Then apart from that, the other parameter that we can talk about is the parameter down here where it is saying drugs as well as IV fluids. So if you have started the patient on any IV fluids, you are going, we'll start with the drugs. If you have started the patient on any drug, let's say when the patient came in, or at this particular point, you have started the patient on metronidazole. It means here you record to say you have given the patient metronidazole. If you have given normal saline, you have given normal saline, you record to say you have given normal saline 500 mils. Like that. So this particular portion, you just record whatever drugs that have been given to the patient or fluids that have been given. If there is no drug that have been given, well and good, you leave it blank. If you have given an antibiotic or anything, you record it on this particular portion. So this particular part, again, you need to record the mother's pulse, the mother's blood pressure. You need to record it here as well as the mother's temperature, which you need to record at this particular portion. So if you check the mother's blood pressure, let's say this, you have opened the Partograph at 6 centimeters. So you follow the same box down on boxes downwards as well as boxes up. That particular part we started from. So you follow the same line, the same boxes. So now let's say this woman, you check her blood pressure using a sphygmomanometer. You'll find that her blood pressure is 130/100. It means that you're going to follow this line. If this is where 6 centimeter is, you put an arrow like that. And where you go where 100 is, you put an arrow like that. And then you shade this particular line. It shows that the woman's blood pressure is 130/100. 100. Then when it comes to the pulse, let's say you check the pulse of this woman and the pulse, let's say the pulse is around 80 beats per minute. It means that you follow this line and put a dot on the same line like that. And the dot indicates pulse. It means that this woman's pulse is 80 beats per minute. Then when it comes to temperature, you get, you check, once you check the patient's temperature, you find that her temperature is, let's say, 36.5 degrees Celsius. You just record it here to say the temperature is 36.5 degrees Celsius, like that. So you record it in that particular box. But you'll find that certain Partographs, you also record the temperature here, meaning you use different pens, because also temperature, you use dots, and then you'll be joining the dots like that to give you a particular curve as you continue checking the temperature. So apart from that, you'll find that when it comes to recording the pulse, you need to record the pulse every 30 minutes. Then apart from that, you also need to record the blood pressure, the pulse every 30 minutes once this woman is admitted in labor. So the OBS, you need to do them every 30 minutes, and you continue recording and checking how this woman's labor is progressing, as well as her condition as well. Then the last thing that you need to check is urine. When it comes to urine, you need to record the woman's urine output every 2 hourly or 4 hourly. So you need to check the urine output every 2 hourly or 4 hourly. And once you get the urine, you need to do some type of mini urinalysis where you check for protein. If there's presence of protein, you indicate with a plus that proteins are there. If there's presence of acetone, you indicate if there's, and also indicate the volume. So let's say when the urine comes out from this woman, the urine output is 250 mils. It means that here you record, you say 250 mils, like that. Then if there's presence of acetone, you record. If there's presence of proteins, you record. Remember, presence of proteins, it may indicate that this particular woman has preeclampsia, hypertension in pregnancy. Then acetone as well may indicate that this woman is lacking the energy, because now the body is breaking down the fats for glucose. So you need to give them some energy giving foods, because when the cervix reaches 10 centimeters wide, they will have it difficult to push. Apart from that, it may just indicate maybe this is a diabetic woman, may go into ketoacidosis because of the acetone presence. So in terms of urine, these are the things that you need to check. You need to do them 2 hourly or 4 hourly. So when it comes to the Partograph, these are the parameters that you need to record. Just remember that this is the tool we use to monitor the progress of labor in a woman who is pregnant and admitted to the labor ward. So remember that you always start with this particular part. Come check the amniotic fluid mounting, fetal heart rate. Then use oxytocin given, indicate that it has been given, and also record the drops in a minute. Record if there are any drugs given, and then check the mother's pulse to check the urine at least 2 to 4 hourly. So this is how you record the Partograph, and how you record it will depend on the parameters that this particular client have during your OSCE examination. So we'll end here.